We're here with Ryan Terlecki, premier reconstructive urological surgeon, one of the rising stars, and we are so honored that we have you here because you invested your time. You came with your family, your wife, and this is really, really great honor.
Thank you.
Hey, Ryan, you really pointed out the important things in life, burnout, and I probably haven't seen a presentation that is so real and really caught my attention, my emotions, and I think the audience was really awed by your presentation. So I'd like to know a little bit about Ryan. First, where is home? Where did you grow up? What are the things you do now to prevent burnout? And what triggered you to change your lifestyle or behavior or whatever? And, if you could give me an idea.
Absolutely. Well, first, let me just say it's an honor for me to have been here and to be working alongside with so many amazing speakers, amazing urologists, and even the audience that assembled for this. We're just such an amazing group of people. So in terms of where I grew up, my background, I'm from Michigan. I grew up in the Detroit area. So my mom remarried when I was 2 and moved me out of the city. Grew up in the suburbs just south, and I was raised there, did my education, and went back to the city of Detroit, where I met my wife. She was actually my landlady in medical school. She had purchased a duplex, and I rented out the lower half, and we've been together almost 20 years. So yeah, started dating as students in the same class, and 4 kids later, here we are. And that's an intense group of experiences going through that together, because it's a heavy demand on your time, as you know. And trying to do that at the same time as raising a family, and you kind of become like passing ships. And so I was always driven to kind of prove myself. I felt like I had this chip on my shoulder based on some childhood experiences, and I felt that I was kind of an underdog all the time. And I guess that serves as motivation sometimes, but it can also be destructive. And as I pushed forward, I started to prioritize things, I would say, inappropriately. So I wanted to be the best at what I was doing career-wise, and too often that was taking the front seat and putting the people closest to me and what should be the most important thing in my life in the back seat. And it was clear that it was becoming destructive. And I was becoming stressed, coming home, working on academic things until late at night, and then going to bed exhausted, waking up, and just a lot of stress. And finally I could tell it was getting to the point where it was threatening my relationship with my wife. And there's a little bit of machismo in the family, and the concept of talking about problems with somebody else, with a professional, didn't really go over that well initially, but finally I had to decide what's most important to me. And I realized it was my family. And so I had met with someone, and he very quickly teased out the fact that I never learned to say no appropriately. And I was a yes man. Can you do this project? Sure. Can you do this? I wanted to please people, right? And I wanted to maintain that positive impression. And in some ways that's important, as you're trying to kind of rise through the ranks and to do things, but you need to have balance, and I was clearly out of balance. And one of the things I mentioned in the lecture is that it became very clear to me that divorce was inevitable, but not divorce from my wife. I had to divorce myself from my own behaviors, my own way of thinking, and to realize that urology wasn't going to love me back. And I needed to figure things out in such a way that I could be productive at work, but be present at home. And so I learned to say what does work for me, what doesn't work for me, and to really keep a clear eye on my priorities. Yeah, so.
That took a lot of courage, I gotta say. But what are your hobbies then? Sports, music, cooking, what? Tell me a little bit about it.
Oh man, people talk about how physicians, it's very hard to retire. right? Because you get so bored, or and then some people linger. I have a lot of outside interests, and as I've gotten older, they've changed somewhat. I've tried to look at those things I can share with my family, so I can enjoy those recreational activities, but sometimes you need things just for yourself as well. I try to stay fit. I like to exercise. Lately I've been taking my kids to the Y with me and trying to see what we can do together, so it gives us an opportunity to talk while we're doing it. How's school? How are sports? My 13-year-old son, you like girls, tell me about that. And but I love to fish. I grew up in the Great Lakes, and so big fishing and outdoors family. I try to continue that in North Carolina now, so we'll do some fly fishing. I'll take the kids out. All of my kids are somewhat interested in that. My wife's a great sport. Things like golf and tennis I enjoy, but depending on the kids' interests, all their sporting activities, you kind of have to pick and choose sometimes. And we love to ski. So, this location was great. My wife and I both brought our skis. We take the kids skiing a few times a year. It's great exercise. It's something we can all do together. So, but like most American families, we like some, more mindless downtime. Maybe we'll watch a movie together. But I really love the times when everyone's around the dinner table together. No electronics, right? And so at different times of the year, it's just amazing, because if the sports schedules have taken a lull and everybody's there at the same time, and you're talking and the dynamic is there, that's my favorite. I can't think anything better than that.
It's incredible. All the kids, they have their own opinion about everything.
Oh,
right?
man.
Yeah.
Oh man. Yeah. So 4 kids, 5 opinions.
Yes. That's interesting. And you have strong leaders at your institution that really allow you then. That's what I got from your talk, is that the leaders there, your leader and your boss, they know, they can understand that everybody needs a life also. And I think that's important. And I think you're going to be a great leader about trying to implement that for your trainees and fellows. So where do you think that, first of all, what are the differences since you are a resident and now that you're an attending and a world well-known, renowned surgeon? What do you see a lot of difference from, in terms of healthcare system, let's say that,
Yeah, I think that we've seen a number of changes, and you've been witness to these as well. And so physicians in training, the hour restrictions now, there's perhaps different expectations about the work-life balance, whereas before you viewed the word resident, based on its historical terms, you were going to live, eat, and breathe the hospital. And a lot of times people might postpone starting a family, for example, and making other inroads in life. But now it's different. We're seeing a lot of people coming through training, having kids, and so forth. It's more the norm than it was in the past. And now we're trying to fit the same amount of education into less time. And surgical technology has changed, right? And so that has impacts on education and trying to translate those skills. And with the slope of technology changing so rapidly, you have to balance attending faculty learning new things and then trying to give enough exposure to the surgeons in training to learn those as well. And that's a little tricky. We're also facing a different patient population. They're more well-informed than ever before. I mean, the dissemination of information via the web, it's crazy. And so, we've prioritized their customer satisfaction to a greater degree, and it's made systems more competitive. And so they look at online ratings. And so, I think the number of patients who do a web search on their physician before they see them now is extremely high. And, trying to find that balance between appearances and content, okay? And, but when the patient comes in and they've looked on Google and they're questioning your decisions, in the past, physicians didn't have to deal with that. It was, whatever you say, and, but I think that there needs to be a balance there. It's good to, get some interest on the part of the patient and to have those discussions and to validate their concerns and their inquiries. So the way we communicate has had to evolve as well. And so, I think that medicine, urology especially, tends to attract some dynamic personalities that should be able to adjust to those changes in real time. But sometimes old habits die hard. Sometimes people resist change, and that can factor into burnout as well. The electronic medical record, is it's a headache for a lot of people, and it's unfortunately something that's probably here to stay. The days of being able to scribble a couple words onto a paper chart and have that suffice because you knew what it meant are gone. And so it takes a little bit more time, and time that's not necessarily personal interaction time.
Yeah.
Like, the time that you and I share together is meaningful for us. Similarly, the time you and I spend with our patients is meaningful for them. But if we feel that there's more and more of a demand on our time, we tend to cut short that personal interaction time so that we can finish all this computer documentation and everything else. And that's unfortunate. So we have to become more efficient, still prioritize what's important, and find that balance.
I really enjoy this conversation, getting to know you. And every time I talk to you, you're warmer and warmer. You're an incredible person, and I'm sure you're gonna be very happy in the future, and we're gonna keep talking.
Yeah, and I got to say thanks again, because one of the things I've learned coming up is that, in my personal opinion, there's no such thing as a self-made man. Right? We're all a product of the interactions we've had with other people, both personally and professionally. And you've been a mentor to me, you've been an advocate for me, other members of the faculty at Colorado and abroad, so I'm aware of that. And the whole concept of seeing farther by standing on the shoulders of giants, I think, is very true, especially in medicine, because everyone owes someone else for taking steps and then sharing that knowledge that comes from that. And so, I'm very grateful to you and to the other people at this meeting.
Thank you for the future and for allowing us to continue with Ralph's legacy. Thank you very much.
Thank you.